Dengue fever strikes across the Caribbean. Belize's PUMP party scores a massive victory in the country's general elections. CARICOM says it has a friend in U.S. President-elect Joe Biden. St. Lucia records its first COVID-19 deaths, while the death toll in Guyana reaches 130 people. Dominica makes wearing a mask mandatory in all public places. A major breakthrough in the race for a COVID-19 vaccine. Caribbean cruise lines are looking for volunteers to set sail on test runs. And relationship coach Keishorn Scott joins us with tips on marriage and dating during the pandemic.
This is the Caribbean Times News with Alisha Davis.
I'm Alisha Davis in New York. Thanks for watching. And we begin with our top story. Dengue fever is hitting many Caribbean nations. Cases of the mosquito-borne disease have recently been reported in St. Lucia, St. Vincent and the Grenadines, Barbados, and the British Virgin Islands. St. Lucia has confirmed over 880 cases with another 300 suspected cases. St. Vincent and the Grenadines has confirmed more than 1,100 cases. Barbados has reported 38 hospitalizations, and 69 cases have been confirmed in the British Virgin Islands. Well, now to Belize, where the People's United Party has won the country's general elections, and its leader, John Briceño, was sworn in as the country's prime minister. Briceño thanked the nation and asked that citizens come together to build a better Belize. It was a massive victory for the PUP, which swept 26 out of 31 parliamentary seats. The leader of the United Democratic Party conceded after 3 terms in power and wished the People's United Party a successful administration. Meanwhile, CARICOM says it's looking forward to working with the new United States President-elect Joe Biden. In a statement, CARICOM's chairman congratulated Biden and Vice President-elect Kamala Harris, saying that Biden will be taking up the office during challenging times, and the president-elect's experience as former vice president under Barack Obama will be of great value to the global community. He added that Biden has been a friend to CARICOM in the past and that the community eagerly awaits collaborating with the new administration. Well, St. Lucia has recorded its first 2 COVID-19 deaths within hours of one another. The first was a 47-year-old man and the second, a 78-year-old man. St. Lucia's chief medical officer also confirmed 6 new COVID cases, bringing the island's total to 148. Prime Minister Alan Chastanet recently hinted that stricter measures or even a lockdown could be necessary to prevent the spread of COVID-19 if people continue to disobey current measures. Meanwhile, the death toll from COVID-19 in Guyana has passed 130 people dead from the virus. Guyana's COVID-19 death toll has been climbing steadily, with the country seeing 89 deaths since the start of September. The total number of active cases in the country stands at more than 750 infected people. And ominous news for the cruise industry. COVID-19 has made its way on board the first cruise ship to resume sailing in the Caribbean. A passenger on board the Sea Dream 1 cruise ship reportedly tested positive. That ship is now back in port at Bridgetown, Barbados, where it originated last Saturday. The cruise line says that all 53 passengers tested negative before boarding that ship in Barbados. Well, coming up, a major breakthrough in the race for a COVID-19 vaccine. We'll have details on American drug maker Pfizer's announcement that a COVID-19 vaccine could be coming before the end of the year. And looking for love during the pandemic? We'll talk to relationship coach Keishorn Scott about finding and keeping your romance going in challenging times. Stay with us.
Since the coronavirus, global travel seems risky. But with Promo Caribbean, you don't have to worry. Our COVID-19 alerts feature, coupled with our comprehensive travel guide featuring over 20 countries, contains all you need to keep updated and safe during the pandemic. Whether it's Belize, Barbados, Haiti, or Guyana, our travel guide has all you need, from safe places to eat, transport options, pharmacies, embassies, hotels, and Airbnbs. Not feeling well? You could take the COVID self-assessment test on our app. If you happen to be in the Caribbean or are looking to travel during these uncertain times, then Promo Caribbean is going to be your best friend. Today more than ever, you need to stay informed and stay safe. With Promo Caribbean, you don't have to worry. We've got you. Download the app from the App Store or Play Store now.
Welcome back to Caribbean Times News and new COVID-19 guidelines in Dominica. Wearing a mask will now be mandatory there in all public places. The mandate comes as an increase in coronavirus cases has recently been reported in the country. An epidemiologist in Dominica said that there is no evidence of mass exposure to COVID-19 in the country. The Attorney General says that the mandate's purpose is to get people to recognize the importance of wearing masks for their own protection. Health authorities in Grenada are defending their recent decision to recommend the reopening of schools on the island. The country's chief medical officer, Dr. Sean Charles, said that returning to in-person learning for school children will not bring additional risks as the country currently has no community spread of COVID-19. He added that the decision is based on the World Health Organization's COVID-19 research that says that serious illness in children is infrequent, but that staff and students should still adhere to recommended hygiene protocols. Well, Republic Bank is announcing a 43% decrease in revenue in 2020 compared to the same period last year. Chairman Vincent Pereira attributed the decline to the pandemic. Pereira did report an increase in assets by almost 20%, which came as a result of the company's acquisition of Scotiabank's operations in a number of Caribbean countries, including St. Martin, Anguilla, and St. Kitts and Nevis. Well, help is on the way for Jamaica's farmers and fishers. Prime Minister Andrew Holness says that the government is putting a program in place to help farmers and fishers hurt by the recent spate of heavy rains and flooding. The Prime Minister noted, however, that some efforts, like the patching of roads, will have to wait until the threat of tropical storms has passed. Meanwhile, Jamaica has announced a statue of its legendary Olympic sprinter Usain Bolt. Jamaica's Minister of Culture, Gender, Entertainment and Sports says the statue will be installed in Bolt's native parish of Trelawney by the end of the year. And St. Croix's popular Christmas festival is going virtual this year. The island's annual holiday celebration will run online from December 11th to January 6th. It will feature a robust lineup of music, entertainment, and virtual events. That's according to the U.S. Virgin Islands Division of Festivals. The move comes after the U.S. Virgin Islands held a very popular online version of its carnival back in April. Well, coming up, a medical breakthrough. We will talk with Dr. Will Morris of the Cleveland Clinic about whether we could see a COVID-19 vaccine before the end of the year. And cruise lines looking for volunteers to set sail. We'll have the details after the break. Stay with us. Caribbean Times News is expanding its reach, and businesses now have super exciting options to reach thousands of potential customers. From traditional paper, digital, and video. Join the Caribbean Times News family today at CaribbeanTimesNYC.com. Our newspaper and website reach over 70,000 unique readers through Brooklyn and Queens and 30,000 plus monthly online visitors. And now, video. Watch the new Caribbean Times News with Alisha Davis online at www.facebook.com/Caribbean Times News. Now is the time to snap up competitive advertising rates. Reach people right in their living rooms. Call 718-909-1841 for advertising rates and other information. Welcome back to Caribbean Times News and a series of medical innovations on the horizon, including what appears to be a significant breakthrough in the race for a COVID-19 vaccine. Earlier, I spoke with Dr. Will Morris, the Executive Medical Director of Cleveland Clinic Innovations, about the potential vaccine and other medical breakthroughs to come. Dr. Morris, thank you for joining us.
Absolute pleasure.
Now, American drug maker Pfizer and a German partner say that they may have an effective vaccine. This is still early data, but what do you make of this news?
Yeah, well, I think, twofold. One is it's absolute tremendous innovation. When you think about the time cycle traditionally, when developing a vaccine and how it can get to market, these are years, and we're talking months. So just in and of itself, that's something to say, wow, when this not just the nation, but when the globe truly comes together and focuses on a call to action It's amazing what we all can do as human beings when, we have a clear North Star. Now, with that said, while the news is very, very promising and exciting, I think, still it's sobering to remind us that we still need to do all of the proper prevention, right? We don't yet have vaccinated patients. So we need to continue with social distancing, washing hands, doing appropriate masking. We need to take this onus in and of ourselves. So it's a far cry to say mission accomplished.
So what is the timeline for getting a vaccine to people in the U.S., the Caribbean, and around the world?
Yeah, well, I think that's a phenomenal question. And then who gets it, right? So there's a logistic challenge. How do you distribute this vaccine to all of the patients? Number two is, well, who is at risk first? Who should get this vaccine first? And how do we manage it? And then how do we, when other vaccine companies come up online, is how do we actually orchestrate, all of those pieces? I think that's going to take an unbelievable degree of cooperation between nations and public health officials to really drive this. So again, there's so many variables and pieces that I think we need to kind of be cognizant of. And it's going to take time.
And what do you say to people who might be skeptical about either the safety or the timing of this vaccine?
Yeah, I think, Liz, as a physician, the science and the data speaks for itself. And so we need to be healthy skeptics. And I think anyone, one need not be a nurse or a physician to be a healthy skeptic. We should understand what the performance is. And we need to trust the science to scientists and trust the data to those who are producing it. And only then do we say, yes, this is actually in the best interest for the public good, and the safety profile, the efficacy, meaning how well it performs, is one that warrants vaccination. It should not be politicized. COVID is not a political issue. It's a global issue, and the science needs to be the overwhelming North Star.
And right now we are seeing COVID rates on the rise all around the world. I mean, could this vaccine ultimately end the pandemic? And if so, when would that be?
Yeah, that's a great question. Certainly this third wave that at least we're experiencing in the United States is not going to be mitigated by the vaccine, right? Just the presence of having a vaccine, COVID doesn't care, right? It's affecting patients every single day. We're seeing the numbers rise, and that's why it's so important for us to not lose, guard around just the simple preventative measures. How the vaccine performs both for, 2021 is still be determined. You need to have what's called herd immunity, right? Enough patients who have protection to protect those who perhaps can't get the vaccine or who didn't get it. And so that's a volume game, right? We need to get enough people vaccinated, and the vaccine itself needs to be one that protects. The questions on the table are going to be then, does the immunity wane over time? I lucked out with having coronavirus back in March. I can tell you firsthand, I wouldn't wish this on my worst enemy. It is a very, very serious illness. But the question that I have is, just by having immunity, it doesn't confer lifelong risks. So it could be like the annual flu vaccine, and where this is part of the new normal that we need to now, do these public health measures to prevent both coronavirus, but there's seasonal flu and there's other world pandemics that we need to be cognizant of.
So many questions still out
Yes.
there, but it is good news. And turning to some other medical breakthroughs that are on the horizon, the Cleveland Clinic has unveiled its top 10 medical innovations for 2021. And one of those innovations could aid in the fight against prostate cancer, which is actually the second leading cause of cancer death among men in the U.S. We just saw Al Roker from NBC's Today Show recently revealing his prostate cancer diagnosis. So tell us about this potential new treatment.
Yeah, so there's a lot of interesting therapeutics. If you look at the list, I think, rather than looking at the specifics, if I had to say there's one core hypothesis, it's evidence and science, and that's how we chose these. These are new innovations, new novel drug targets that bring new treatment to bear for patients who otherwise didn't have an option. And so whether it be the novel therapy in prostate cancer, another one around migraine prophylaxis, and then multiple sclerosis, these are exciting new kind of breakthrough therapies that offer new treatment options for patients at risk, B, help decrease the mortality, morbidity, the impact of these terrible, terrible diseases. And then 3 is bring a quality of life that I think is really, really important for patients. So if I look at the number 1, where we talked about potential gene cures, which we don't really use that often in medicine, around sickle cell disease or thalassemia, right? These are anemias. These are mind-boggling ideas where an intervention actually cures it. It's not just maintaining a chronic disease, but it actually is fundamentally curing it. That is absolutely mind-boggling, to think about, and it is so exciting to see these new therapies and these collaborations come together to bring what I think is the most important thing as humans. What we do is try to serve one another and keep each other healthy.
So exciting and bringing so much hope to so many people. And I found that another one of your top 10 innovations, so interesting, telemedicine. I mean, with the pandemic, we've seen a huge increase in this kind of virtual care. Do you think that telemedicine is going to basically be the way of the future?
I think it's a new tool in the toolbox. Much like we're communicating over Skype, a lot of the therapies that we can do can be over telemedicine. And so why we chose that telemedicine was appropriate was in healthcare, we get stuck in a rut. We do a lot of things because we've always done it some way. And what COVID forced us to do as providers to question the very nature of what does it mean to actually interact and actually manage, evaluate, and treat a patient. It changed our biases. We are very creatures of habit as physicians and nurses and caregivers. And so that allowed us to challenge that, and actually, to our surprise, patients actually enjoyed it, right? You don't want to come in necessarily to a hospital or to a clinic to be exposed if it's an annual visit or if it's a mental health visit. So how do we meet the patient where they are, as opposed to the patient having to meet us as clinicians? And so I think it's changed the way we think. It's changed also the policies that have been barriers for these types of telemedicine visits. So especially in the United States, where each state has different laws and different payment, it set up all of these artificial barriers. And with COVID, we were able to move that away and focus on the one thing that's important, which is the patient. And I think that by having that clarity of purpose, it allows unbelievable innovation and unbelievable new aspects. So if your original question is, will this be the new normal? Will all medicine be through telemedicine? Well, certainly not. There's certain things that we can't do, obviously. But I think it's going to be a powerful tool that allows us to address health disparities, inequities, and just frankly, barriers to access healthcare.
Exactly. For underserved communities in the U.S. and in developing countries like the Caribbean, it looks like telemedicine is something that's going to be a really important tool in expanding that healthcare service, right?
You're exactly right. Absolutely right.
Well, Dr. Morris, thank you so much for joining us. We have learned so much today, and I so appreciate it.
I absolutely enjoyed the conversation, and be safe, and thank you for this opportunity.
Coming up, the pandemic has taken its toll on many relationships. We'll talk to best-selling author and relationship coach Keishorn Scott about finding love during COVID. And cruise lines are looking for volunteers to set sail. We'll have all the details coming up.
Do you need a training classroom in the heart of Brooklyn, New York? Whether you're planning a one-day training program or a weekly training course, the Level Up Center has training room solutions especially for you. The Level Up Center provides classroom-style training rooms for rent in the heart of Brooklyn, right near Prospect Park, and easily accessible by subway. Our flexible, scalable services will anticipate and cover your every need, so you can deliver the perfect training program. Our training rooms are equipped with high-speed internet, 50-inch TVs, giant whiteboards, chairs and desks. Our rooms are cleaned and disinfected every day, and after each training session. Everything gets cleaned and nothing gets missed, all to provide you with the safest and cleanest training environment. The Level Up Training Center offers conveniences you won't find anywhere else, at pricing that is the most cost-effective in the industry. Our training rooms are available monthly, weekly, daily, or hourly. Call the Level Up Center at 646-573-5794 today for more information.
Welcome back to Caribbean Times News. And with COVID cases on the rise around the globe, we've seen the impact of the pandemic on relationships and serious domestic issues like domestic violence, teen pregnancy, and child abuse. Well, earlier I spoke with Keyshawn Scott. He is a relationship coach and the author of the New York Times bestseller Life, about managing romantic relationships in these difficult times. Mr. Scott, thank you for joining us.
Thank you for having me. It's a pleasure. Thank you so much.
Now, in some places that have emerged from COVID-19 lockdown, we've actually seen divorce rates increase drastically. What are you seeing out there, and what do you make of it?
I see the same thing. A lot of people are going through some tough times in their relationship, their marriage, due to lack of money, lack of escape, children. They're home with the kids 24/7. And from going to work 10 hours a day, 12 hours a day, now you're in your home consistently doing the same thing over and over again when you were used to a routine. So your routine is broken now, and you don't know how to cope with your spouse, the kids, and things are just running like a rampage around your life. So it's difficult to cope with those things.
It's a big change for a lot of people. And now we see the term quarantine bae. That's being used to describe people who maybe got into a relationship during quarantine, at least in part to have somebody to spend that time with. What do you think of those relationships? And can they survive when the need to quarantine ends?
It could survive based on the foundation it was built with. A lot of relationships don't survive because a lot of people are looking for someone to pass time with. Pastime is not purpose in a relationship. You need a relationship that has a destination, that has substance, that has purpose. And a lot of us, we're just dating to pass time because we're bored. We need some attention. We need some affection. And we need someone to just be with us along the way to help us navigate throughout our loneliness. So a lot of us are falling in love out of loneliness.
So now quickly, what are your top 3 tips for people who are managing relationships during all the stress and the economic anxiety and the uncertainty of this pandemic?
One thing is put yourself first. A lot of us, we're in relationships, and the best relationship we have should be with ourselves. Put yourself first. Take a mental break. Work on your mental health. Work on your strengths and weaknesses. And if you are in a relationship or, build a relationship that you're in, I will say work on your insecurities, work on healing, work on loving yourself, taking care of yourself. And this is a perfect time to really build with your family. The people who you haven't spoken to in so long, this is your chance to reunite, and just be yourself and love yourself and take the time to work on it.
And now, any advice for individuals who say maybe dating and they want to take it to the commitment level, not necessarily even marriage, it could be, but it could also be, say, exclusivity?
Yeah. My perfect advice for that is don't rush. Take your time. A lot of people love to rush into relationships just to say that they have someone, because saying that you have someone is better than being alone. And loneliness is scary. So you might be jumping into another relationship based on a failed relationship from your past. So my advice is to slow down, don't compromise too much, don't settle. And back to what I said just now, work on yourself and know the balance between we and me. Because a lot of people jump into relationships and it's we, and you forget about yourself in the whole entire process. You forget about your dreams, you forget about your goals, you forget about what makes you happy. And in that relationship, you just invest in your partner and you never invest in yourself. So if that relationship doesn't work after the holidays, you have to find yourself all over again because you've invested so much in a person and not in yourself as well.
I know, what's your biggest piece of advice for married or deeply committed couples that are actually on the fence about whether to call it quits or whether they should push forward?
My best, I said the one was before was best, but this is the best of the best. This best one is, if you're a couple right now and you're going through a lot and you're on the fence of ending it all, make sure that you gave it all you got. Make sure you have exhausted everything, all the efforts, Make sure you spoke about it. You went to therapy. You seen a coach. You spoke to someone, a professional, about what you're going through, and you actually work towards it rather than letting your emotions and your feelings get the best of you. And you made quarantine or COVID decisions. And I said that before in the last interview. A lot of people are making quarantine decisions because of this is a time for you to actually really get to know who you are and your spouse. And so a lot of people, we let our feelings get the best of us. How we feel, we wake up, we're upset, we're angry. We let all of those things get the best of us. So my best piece of advice is if you exhausted everything, you really put in all the work and you still didn't get anything back in return, then you make an exit plan together. You're still together. It's not just you're making an exit plan. You still make the exit plan together. And for those who just got into a relationship, like I said, work on yourself, love yourself, and just give it all you got and make sure it's something that you want for a future and not just to pass time.
That's great advice. Either way, put in the work. And one final question for you. You mentioned the holidays. I mean, the holidays can really add stress, and we're coming into a holiday season unlike any other thanks to COVID. So is there anything that people should keep in mind?
Yeah. One of the best advice I will give them for that is don't rush into the relationship again, and don't think that you're going to meet their parents and, you're in love. Just relax. Don't go too fast. A lot of people, they're in relationships or they're not in a relationship. So for the people who are in a relationship, they want to meet the partner's family. They want to do everything with them. Spend time with your friends as well. Don't forget about your friends, because after all all the feelings of the holiday time is, worn out, then they might not want you anymore. And then you'll start to heal and you have to do all of this over again. If you are healing and you just got out of a relationship, it's okay. Take time for yourself. Take time to heal, mend your heart, and get yourself back together. It's okay to be alone on holidays. There's nothing wrong with it. It's okay to be single. There's nothing wrong with it. It's not a curse. It's okay. So embrace your singleness, embrace who you are, and enjoy yourself during the holidays.
I think that is a very important message, especially this holiday where a lot of people, to keep safe, are going to have to maybe not get together in the way that they would like. But you can still do the work and you can still enjoy the holiday. It's a great, great piece of advice. Thank you.
You're welcome.
Mr. Scott, you got to come back.
I'm here. I'm not going anywhere. I think I'm in home. So...
And you can find Keyshawn Scott's books, including his New York Times bestseller, Life, and his latest, The Heartbreak Workbook, wherever books are sold. Coming up, are you ready to take a cruise? Caribbean Cruise Lines are looking for volunteers. And a private island resort in St. Vincent and the Grenadines reopens. We will take you there after the break. Stay with us. Welcome back to Caribbean Times News. And cruise lines looking for volunteers to come aboard and set sail on test runs. The test runs are part of the CDC's new COVID-19 requirements that cruise lines must complete before being authorized to set sail again. The volunteers would have to sign waivers acknowledging that they are potentially putting themselves at risk. But that's not stopping many would-be cruisers from trying to sign up. Although details for how to volunteer have not been released yet, Royal Caribbean says it's received more than 5,000 emails expressing interest. And finally, in our Caribbean Moment by Caribbean Journal, private island resort Petit St. Vincent in the Grenadines has officially reopened. Set on 115 acres, the Petit St. Vincent is one of the country's approved bubble resorts. St. Vincent and the Grenadines has been reopened for tourism since July. What a beautiful place. And that does it for this edition of the Caribbean Times News. You can catch us every Sunday at 7 p.m. Eastern on Caravision. Check your local cable listings for channel information. And you can also catch us streaming on Facebook Live Sundays at 7:30 p.m. Eastern. Or like us and subscribe to our YouTube channel, Caribbean Times News. But wherever you catch us, thanks for watching and have a wonderful week.